Hello, I'm Dr. DePaulo, and I'm here today to try to answer a patient's question, why am I having panic attacks? First, what is a panic attack? A panic attack is the sudden onset of extreme anxiety, usually associated with physical symptoms such as lightheadedness, nausea, dizziness, but also sweating, rapid heartbeat, and sometimes rapid breathing. There are kind of three patterns of panic attacks that occur in humans. There are many people that will have one or two in a lifetime, usually separated by many years, sometimes brought on by appropriate circumstances, such as having to run out of a building while it's on fire, such as people did in 9/11. Second pattern is that number of people who have problems with anxiety that they've had for a while, all of a sudden will get what we call a panic attack in a situation that made them nervous before but didn't particularly cause one of these terrible panic attacks. And those we refer to as anxiety disorders, and we'll get back to that later. The third pattern is that these things often occur when people have the onset of episodes of depression, and because anxiety is a very big part of all depressive illnesses. Now, the other part of this question is, why does anyone get a panic attack? As I said, it's not only a hard question to answer, we don't have a full answer. What we do know is that in mammals, mammalian species, that there is a mechanism that's sometimes called the stress mechanism, sometimes called the fight or flight mechanism. It involves the hypothalamus in the brain and the pituitary gland, and also the adrenal gland that secrete hormones. Okay, and those hormones prepare us, if you will, to be able to either fight or to run away. It can be set off by certain circumstances that would cause some stress in the person, but it's setting off this emergency system, this emergency fight or flight system, at a time when it's not appropriate, such as being in a middle seat on an airplane, feeling crowded, being on the top of a tall building that might have made you anxious before, but now it's setting off this extreme panic attack. With anxiety disorders and with depressive disorders, there's both medication treatments and there are also behavioral or psychological treatments. And both can be quite important and quite helpful. The psychological or behavioral treatment is sometimes called desensitization. So that if it's a dirty doorknob that gives you a panic attack, even though before you might have had a thought about germs but didn't stop you, a therapist can work with you. And actually, the best part of the treatment is when they get you to handle that and actually put dirt on it ahead of time and stay there with you so that you have a manageable reaction and it lasts long enough so that your body that fatigues in a good way, so that the next time you do it, it's easier, and then it's easier again. There are really two types of medications we use in treating both panic attacks and depression and anxiety states, and they are most antidepressants, not every single one, but almost all antidepressants work as well or better for anxiety than they do for depression. So those are good. There are another set of drugs that are anti-anxiety medications, such as Valium or Xanax, and they are very effective in the short run. They do have some addictive potential, and that can be a problem for some patients who are getting a lot of panic attacks. Let me finish by saying that panic attacks are very distressing and very uncomfortable to experience, but they are very treatable, whether they come alone as part of an anxiety disorder or part of depression. I would make the point that you want to treat the depression and that treating the panic in those patients alone may not be enough. Okay, thanks.